If you've had prostate surgery and you're still leaking urine, you're probably wondering whether you're doing something wrong. The good news is that many men experience urinary leakage after surgery, and it's not always because they're not doing enough pelvic floor exercises. In fact, there are several everyday habits that can make leakage worse without you even realizing it. In this video, I'm going to walk you through 5 of the most common ones and what you can do to give yourself the best chance of recovering well. If we haven't met before, my name is Murray-Skey. I'm a physiotherapist specializing in men's health and helping men recover after prostate surgery. On this channel, I share evidence-informed advice to help you reduce urinary leakage, regain confidence, and safely return to the activities that matter most to you. If that sounds helpful, consider subscribing so you don't miss future videos. Now let's get into it. Number 1, go to the toilet just in case. One of the biggest mistakes I see is men going to the toilet every 20 or 30 minutes because they're worried about leaking. It seems logical if your bladder is empty, surely you can't leak. Unfortunately, it doesn't always work that way. Going too frequently can train your bladder to expect smaller volumes of urine, meaning you start feeling the urge to go more often than necessary. If your healthcare team has advised it's appropriate, try gradually returning to a normal bladder routine instead of emptying your bladder just in case. Number 2, constipation. This is one that many people never think about. Your bowel sits directly behind your bladder. If you're constipated, it can increase pressure through the pelvis and make urinary leakage more noticeable. Straining to open your bowels can also place additional stress on the pelvic floor. Making sure you're eating enough fibre, drinking adequate fluids, staying active, and addressing constipation early can all support your recovery. Number 3, too much caffeine or alcohol. I'm definitely not here to tell you that you can never enjoy a coffee again, but both caffeine and alcohol can affect bladder symptoms in some people. They may increase urinary production or irritate the bladder, making urgency and leakage more noticeable. Everyone responds differently, so it's worth paying attention to whether your symptoms are worse after certain drinks. If they are, consider reducing them for a short period and see whether things improve. Number 4, holding your breath during lifting. Whether you're lifting shopping bags, getting back into the gym, gardening, or picking up your grandchildren, holding your breath dramatically increases your pressure inside your abdomen. If your pelvic floor isn't ready to manage that pressure yet, urine leakage can occur. Instead, try breathing out as you perform the effort. It's a simple strategy that can reduce unnecessary pressure while you're continuing to rebuild strength. Number 5, not progressing your rehabilitation. This is probably the biggest one I see. Many men continue doing exactly the same pelvic floor exercises for months, but rehabilitation works like any other form of exercise. If you always lift the same weight, eventually your body stops adapting. Your pelvic floor muscles also need appropriate progression. That may mean changing positions, adding movement, increasing endurance, or integrating the muscles into everyday activities and exercise. If you've reached a plateau, it may be time to have your program reviewed by a men's health physiotherapist. Recovering from prostate surgery isn't always a straight line. Some days you'll leak more than others, and that doesn't necessarily mean you're going backwards. The important thing is to focus on the factors you can control and continue progressing your rehabilitation. If your leaking isn't improving, is getting worse, or you're concerned about your recovery, make sure you speak with your surgeon, GP, continence nurse, or men's health physiotherapist. If you've found this video helpful, I'd really appreciate it if you give it a thumbs up and subscribe to the channel. I post regular videos to help men navigate recovery after prostate surgery, understand their pelvic floor, and confidently return to the activities they enjoy. Thanks so much for watching, and I'll see you in the next video.